Just so that everyone knows, we'll get started in a few minutes.
Good evening, everyone. Good evening, everyone. Yes, great. We're so very happy to have you all here this evening. My name is Dr. Bridget Noonan, and for those of you who don't know, I have the great privilege and pleasure of serving as the Dean of the School of Nursing and Health Professions here at Trinity Washington University. For those of you who don't know, Trinity has a very, very long history of providing programming, providing care in the community, particularly from a social justice standpoint. And as much as I don't want to see this kind of discussion taking place, it's necessary, it's important, it's critical to the health and wellness of our community. And so that's why we're doing this evening. When Nicole, Dr. Beshman, who many of you know, presented this to me, I was like, absolutely, we need to do this because of what it represents for our community here in the District of Columbia, but also in Maryland and Virginia. Our school, the School of Nursing and Health Professions, has a kind of plethora of programming. We have an undergraduate program in nursing. Who's nursing here? Isn't that great, everyone? We have an undergraduate program in occupational therapy. Any occupational therapists in the audience? Yay! We have an undergraduate program in public health folks. Yay! Yay! And this fall, we just started a baccalaureate program in social work. Do we have any social workers in the audience? Yay! We also have a master's degree program in public health. We have an MPH program, and we also have a master's degree in counseling. And that is my field. I'm a clinical counselor educator. I have a master's and a PhD in counseling. And actually, Joseph and I, this is Joe Izzo, everyone, Joseph and I used to run groups at the Whitman Walker Clinic, 30 some odd years ago, for men who were struggling with substance abuse issues, and it's where I met Joe. Joe retired 5 years ago? 6 years ago from the Whitman Walker Clinic, where he served as a senior psychotherapist for 32 years. He has done a great deal for this community, and when Nicole shared with me what she wanted to do, I immediately thought of Joe because I know his work with the Interfaith Gun Violence Prevention Network. That's my really brief saying hello. And at this time, I would like to introduce Tom Kane, who is the current president of the DC Public Health Association, who is a co-sponsor of this event. Tom. You're welcome.
Love the enthusiasm. What a great crowd as some comedians often start their shift with. Thank you all for coming, and I really want to thank Dr. Noonan for co-sponsoring this event with the DCPHA. When we were talking, this program is being held in connection with our annual meeting, and I will have a couple of governance things to cover with the members of the DCPHA before I make my exit stage left from the podium here. But in that regard, anyone isn't a member of the DCPHA and would like to be, we take student members, and we would love to have students as members. Feel free to talk to one of the officers and directors that are here, and I'll point them out in a minute. Or you can go to our website and find a way to actually join the DCPHA. We'd love to have you. As you can see, we're becoming more active post-COVID, and we'd like to keep this up, and we really want to build on the enthusiasm that I see here today in the audience. And I'll also mention a couple of gun violence things at the end of my brief presentation. From the DCPHA, I just want to introduce our governing council members, which is essentially our board of directors. Dr. Nicole Benjamin is standing back there. She's our president-elect, and hopefully at the end of this meeting will become president. Valerie Adams is back there, and she's our vice president. Stephanie Swanson is our secretary, and she's back there. Audrey Timbo is our new treasurer, and she's here somewhere, I think. In the back of Alana Woodbury is our affiliate representative to the APHA Governing Council, and she's also helping with that. And our immediate past president is Aaron Buchanan, and Aaron is also hiding that. Again, if you have any questions about the DCPHA, please seek out any one of us. Probably not during, but maybe after the meeting, and we'd be glad to talk to you. I have a couple of, as I said, governance business items that I'd like to cover for the DCPHA, since this is our annual meeting. And I just want to get a show of hands before we dive into that. How many members of the DCPHA are there present? Raise your hand really high. 1, 2, 3, 4, 5, 6, 7, 8, 9. Did I miss anybody? Okay, it's going to make the business portion of the meeting rather easy. Because it's going to be difficult to take a vote on the issues, but from the board of directors standpoint, I expect that at the end of this meeting, I will roll off as president. Nicole will roll on as president. I will become immediate past president, and Aaron will, we thank Aaron for all of his service over the last 4 or 5 years. She's overdue for a vacation, and she will roll off as immediate past president. So with that, I will conclude that brief portion of the business portion of our annual meeting. A couple of thoughts on gun violence. It's a huge problem. The Surgeon General just issued a report on parental stress, and one of the things noted in that report that contributes to parental stress is gun violence. Gun violence is ubiquitous. It is certainly a bigger problem in some areas than others, but it's a problem everywhere, and it's not talked about enough, and no one is doing nearly close to anything that addresses the public health problem of gun violence challenges with. Here in the District of Columbia, I can say, and I'm not going to ask anybody to pipe up, I have been a victim of gun violence. I live in considered what's one of the better parts of the city, and it happened in front of my house. It's also happened to me outside of a metro station, 3 o'clock in the afternoon on Christmas Day some years ago. So it's a 24/7, 365-day issue. And we need to do something about it. And our panel is going to talk about gun violence. And we're going to talk, hopefully, about what we can do as health practitioners to be public health professionals, and what we can do to contribute to reduction in gun violence and hopefully a safer and a better health in our community. So with that, again, thank you, Dean Noonan. I want to thank the officers and directors of the DCPHA for their service, past and current and future. And with that, I will turn the podium over to others to start our evening special presentation. Thank you very much.
Okay, so before I introduce, would you like to come on? Yeah, come on. This is informal, it's all right. So before I introduce our guests, what can you all tell me about the color orange? Yes?
It's used in hunting.
I'm sorry?
It's used in hunting to see like persons on the field.
Okay, and in reference to our discussion this evening, what does the color orange mean? Dr. Simmons.
The color that we're using to represent to the end to allow prevention. Representative of that.
Ergo why Joseph is wearing an orange t-shirt. And he will explain why the color orange came about for gun violence prevention. For this evening, and we hope that Aalayah will come, but she wasn't feeling well, so she may not join us. But I have, again, the privilege of introducing our two panelists. Colleen Creighton is the Senior Director of End Family Fire. Colleen is the Senior Director of Brady's End Family Fire Program, leading the organization's efforts to promote safe firearm storage and engage firearm owners in ways they can be part of the solution to ending gun violence in America. The End Family Fire Program focuses on using safe storage as a means to reduce unintentional shootings, firearm suicide, and firearm misuse. Colleen's rich professional experiences stem from suicide prevention. We all know what the month of September means. What does the month of September mean? Suicide Prevention Month, right? Suicide prevention and consumer products and injury prevention fields. Before Brady, she was the CEO of the American Association of Suicidology, the oldest membership-based suicide prevention-related organization in the U.S. Glasses on, everyone. And the accrediting body of crisis prevention-related and the accredited body of crisis services, including the 988. What's 988? What do I do if I have an intention of harming myself, thinking of suicide? What can I do? Oh, 988. Everyone knows that? Everyone should know that, right? 988 Suicide and Crisis Lifeline. She also spent more than a decade as the executive director of the Alliance for Consumer Education and as director of the Consumer Healthcare Products Association Educational Foundation. Colleen has played an integral role in launching a number of End Family Fire safe gun storage campaigns that have contributed to increases in program awareness and behavior change among gun owners and non-gun owners. End Family Fire has also won numerous awards under Colleen's leadership, including Shorty Awards for the program's, quote, Prepare for Misuse, end quote, and quote, Safe Stories, end quote, campaigns. Please help me in welcoming Colleen Creighton. So my friend, my very, very, very good friend, Joseph Izzo, and he will introduce himself more. Joe Izzo is a member of the Interfaith Gun Violence Prevention Network. He is a long time, as I said, 32-year psychotherapist for Whitman Walker Clinic. He is now retired 5 years, but spends a great deal of his time still out in the community, serving as a member of the Interfaith Gun Violence Prevention Network, but he also serves as a supervisor for burgeoning social workers. He has played myriad roles in the community and continues to educate himself and others about the importance not only of gun violence prevention, but working with individuals who are in severe mental health crisis. Please help me in welcoming Joseph Izzo. And so, Dr. Beshman, it's all yours, Dan.
Okay, good afternoon, everyone. It's a pleasure being here. Let me just say, I'm one of the very fortunate people whose life has not been touched by gun violence. The reason I got into this is directly related to my faith. For the last 42 years, I've been a member of the Religious Society of Friends, more commonly known as Quakers. We are a traditional pacifist church. We believe that there is that of God in everyone, and therefore everyone is sacred, and violence should be done to no one. Over the last 6 years since I retired, I've also done a deep dive into Buddhism, and I'm a regular practitioner of Buddhist meditation. Buddhism also believes that we should do no harm to any sentient being. That includes the animals and the insects and the fish and the birds, and of course human beings. So that's really how I got involved with this. To be quite frank, during the pandemic I was getting kind of bored, and I was starting to do a search online for something that I could get involved in. And what did I find but the DC Interfaith Gun Violence Prevention Network. And I've been working with them now for the last 5 years. To put this in context, and I think we need a context about what insanity is going on in this country. Most people do not know this, but since the Revolutionary War in the late 1770s until the present, 1,200,000 American soldiers have died in all those wars. But gun violence has taken away since 1968. 56 years, the past 56 years, we have lost 1,500,000 Americans to gun violence. That's more than all the soldiers that have died in all the wars since the beginning of this country. That's insanity. On average, each year, between 40 and 49,000 Americans die from gun violence. 57% of which, and I'm going to leave it to Colleen to flesh this out a little bit more, 57% of which are suicides. As a result, one of the things that I've been doing with the Interfaith Gun Violence Prevention Network, we have been doing gun buyback programs. Recently, in April of this year, we were in Upper Montgomery County, and we did a gun buyback and bought back 107 weapons, some of which were AR-15s, others were handguns, others were hunting rifles, and so forth. We're in the process of planning a gun buyback for Ward 8 sometime in early 2025. So I hope, and I will send the information on to either Nicole or to Dr. Newman, when that thing gets going. And I would definitely like to have some of you come to that buyback in Ward 3, where a lot of the gun violence is happening in this city. Gun violence, from my perspective as a psychotherapist, is a primary mental health and public health problem. Not only does it cause a tremendous unnecessary deaths, it also causes chronic disability and wounding of people by guns, who live with those wounds, both the physical and the mental health aspects of it, for the rest of their lives. They're either paralyzed because the gun has somehow severed their spine, or they're suffering from continuing PTSD, post-traumatic stress disorder. But it's not just the person who's directly affected. It also affects at least 11 other people in that person's life, who very often also suffer from post-traumatic stress disorder, after either witnessing or being a family member or a friend or a coworker of someone who's been affected by gun violence. What we do know is that trauma can be epigenetically transmitted to future generations, especially in vulnerable communities. What that means is that it's not just this generation, it's the next generation, the generation after it. We know this from what happened to Jewish people in the Holocaust. Their family members, many generations later, are still suffering from epigenetically related trauma. So this is a problem that goes through multiple generations. It affects many more people than the ones who are directly affected by being shot. What I'd like to do right now, because one of the things that has happened in this country is that the National Rifle Association has in fact co-opted the Second Amendment. They've co-opted it to make people believe that every person is entitled to have and own a gun. That's not what the Second Amendment says. The Second Amendment guarantees the right of the states, not individuals, to mount a militia to protect the people of the state. Unfortunately, some people on the Supreme Court, some of the justices, have misinterpreted that. The end result is that we now have 16 million AR-15s circulating in this country alone. Those are the weapons of mass shootings. The assault weapon, the AR-15, 16 million. But that pales in numbers as to the number of actual guns and rifles in this country. We have almost 400 million guns in a country of 335 million people. Now, from my perspective as a mental health professional, that's my description of insanity. Why do we need all these guns? And we just had another incident in Winter, Georgia, where a 14-year-old used an AR-15 to kill a number of people and wound others. This is crazy. And so the NRA very often spreads a lot of myths about guns in order to convince people that you have a right to have a gun and to use it anytime you feel threatened. So what I'd like to do is read you the 10 myths that are perpetrated by the NRA and all the people that have misinterpreted the Second Amendment, and give you the response that's the correct one. First myth, a gun in the home makes you safer. Study after study proves that the choice to keep a gun in the home creates far more risk than it prevents. Statistically speaking, home invasions are rare, but shootings by a relative, or acquaintance are all too common with that gun that's being kept in the home. For every time a gun is used in self-defense in the home, there are 7 assaults or murders, 11 suicide attempts, and 4 accidental shootings, very often of little children. Second myth, the only thing that stops a bad guy with a gun is a good guy with a gun. You've probably all heard that myth. Facts simply don't bear this out. Even a highly trained person, such as law enforcement officers, only hit his or her target about 50% of the time. The likelihood that a gun owner with much less training can, in the heat of a mass shooting, take down the right man or woman is extremely low. Worse still, if law enforcement arrives at a time, quote, that good guy with a gun may be mistaken for the perpetrator. Third myth, guns are more likely to protect you than hurt you. Only 1 in 37 gun homicides is a justifiable homicide. In other words, you are 36 times more likely to be killed by a gun as protected by one. And these figures do not even consider the tens of thousands of lives lost each year in firearm suicides and unintentional gun deaths. Only a tiny fraction of the intended victims of violent crime or property crime employ guns for self-defense. Fourth myth, we have a mental health problem. We certainly do. Not a gun problem. Not true. Research indicates that only 3 to 5% of the violent acts that are attributable to persons with serious mental illness, and such violence is typically directed at immediate family members and or mental health practitioners. Those of you going into social work or psychology, you may have a really disturbed client that might want to take you out. So always be prepared. Researchers estimate that persons with mental illness are responsible for fewer than 1% of all gun-related homicides. Persons with mental illness are, however, at a much higher risk for suicide, and they are much more than 10 times more likely to be the victims of violence than the general population. So in fact, mentally ill people do not commit most of the gun violence. They're often the victims of it. And the United States has rates of mental illness comparable to the rest of the world, yet much higher rates of gun ownership and gun violence. Fifth myth, the Supreme Court has ruled that the Second Amendment prohibits any legislation concerning guns. In the case of the District of Columbia versus Heller and the New York State Rifle and Pistol Association versus Bruin, the Supreme Court recognized the right of individuals to possess firearms for home defense and to carry firearms in public without a showing of particularized need. But the court did not prevent all regulation of firearms. In evaluating government regulations of firearms, courts are to determine whether the law in question, quote, is consistent with the nation's historical tradition of firearm regulation, end quote. Laws likely to be upheld under the court's rulings include requirements for background checks, safety training, bans on firearms at schools and other sensitive areas such as churches, grocery stores, movie theaters, etc., and restrictions on automatic and semi-automatic weapons. Sixth myth, gun control doesn't work. Chicago and DC have some of the strictest gun control laws in the country, and yet violence remains high. Chicago and here, the District of Columbia, are both adjacent to states with much looser gun laws, such as Wisconsin, Indiana, and Virginia. It's very easy for gun traffickers to buy as many guns as they want, and take them across state lines. This is why federal regulation is so important. Seventh minute. Instead of making new gun laws, we need to enforce the ones we have. The truth, current gun laws have significant gaps in coverage. For example, under the current law, background checks are required only for sales by licensed gun dealers. The Bipartisan Safer Communities Act, enacted in 2022, clarifies which sellers are required to obtain a federal firearms license, but sales or transfers by others remain exempt. Very often these gun shows, they don't have to require that you be licensed if you buy a gun from a gun show. Eighth myth. The only way for a woman to feel safe is to have a gun. This is the gun industry selling point, not based on fact. Studies show that a gun in a woman's home is far more likely to be used against her or her family members than to defend against an outside attacker. Increasing gun ownership by women would only heighten that risk. One key study concluded that the presence of a firearm in a woman's home triples the odds that she will be killed, usually by an intimate partner. From 2002 until 2012, more women were murdered in the United States by an intimate partner than all the U.S. troops killed in action during the wars in Iraq and Afghanistan combined. Ninth myth. Gun laws don't work because criminals don't obey the law. Gun laws only punish law-abiding gun owners. According to figures from the FBI, as of June 2021, background checks had stopped more than 4 million prohibited gun purchases since 1994. More than 300,000 of those attempted sales were in 2020, and 42% of those were to people with felony criminal convictions. A 2019 study found that the states that required background checks for all gun sales had homicide rates 15% lower than states without such laws over a 26-year period. Final myth. Preventing those contemplating suicide from buying a gun will not prevent them from self-harm. The truth. Suicide attempts are often impulsive acts driven by transient life crises. Also, the other thing that I noticed from having worked with suicidal patients, drugs and alcohol are often involved. Before a suicide attempt, the person will often alter themselves in order to get up the courage to do it. Most attempts are not fatal, and 90% of suicide survivors don't go on to end their own life. Whether a suicide attempt is fatal depends heavily on the lethality of the method used, and firearms are extremely lethal. The most commonly used method in suicide attempts is drug overdose, which is fatal in less than 3% of the cases. But about 85% of suicide attempts with a firearm end in death. So if we want to reduce suicide, and this is Suicide Prevention Month, we need to start addressing the problem of the availability of guns in this society. Now, your eyes are probably glazed over by now. So what are some of the things that we can do to start working on this enormous problem? One of the things, and I've already shared this with you, get involved with some group. The Brady Pact, Giffords Pact, any one of the many different gun violence organizations that are working toward legislation in the states and in the federal government that will control some of the proliferation of guns in this country. If you're involved with a church, a synagogue, a temple, a mosque, get your congregation to join the Interfaith Gun Violence Prevention Network. I have some flyers up here if you're interested. I can share those with you. And I'm going to leave it to Colleen. I was going to talk about some of the other things that we can do to stop gun violence, including things like universal background checks and so forth. But I'll pass it on to you to go ahead and do that.
Sure.
Thank you.
Yep. Now that's good. Is that working? You didn't turn yours off.
Yeah.
Oh, you
Oh.
turn yours off.
I have to turn mine on. Okay.
Or if not, I can even talk loud.
No, not necessarily. Use this one.
All right, is that working? That's working.
That's one.
So I want to start first by acknowledging Aalayah is not here today. She had a medical emergency, is in the hospital. So I just want to send some good vibes her way. But as you might know, if you've seen her bio, she graduated from this college. And so she's wonderful. And if you look at her bio, she's pretty phenomenal in that she survived the Parkland shooting. And how? By powering under a colleague or a student of hers, a classmate. And that's how she survived. And she's had her history too. So if you haven't Googled her, definitely Google her. She has a public profile, so reach out to her. And I'm sure she'll be at the next one. But one of the things I want to make a plug for on that slide, if you look at Team Enough, Aalayah was one of the founders of Team Enough, along with a gentleman called Robert Shendra. And Robert lost his sister at Parkland as well. And so Google them, get involved. I think it's everyone from the ages of 18 to 24 or more. And their sign up, there's a lot of, they'll teach you how to be advocates, how to do lobbying, how to get engaged in your state. It's a pretty cool organization. But a little bit about me, it was a long bio, and I apologize. I've done a lot in the public health space, from working with kids that were ending up in the emergency room because they were ingesting consumer products, and then with babies and pediatrics who were overdosing accidentally on cough and cold medicine, acetaminophen, and then I ended up in the suicide space, where I was part of the American Association of Suicidology. And as part of my role at Suicidology, I was part of the team that made 988 happen. And so it took years, took a lot of walks to Capitol Hill, a lot of miles on the Hill, trying to get everyone involved. But a cool part that a lot of people don't know about 988 is 988 started off as an individual that died by suicide in Utah. Their family said, we wish we had gotten help for our family. And they had a local crisis line in Utah. And they kept saying, this should be a national thing. Everyone said, that will never happen. Don't worry about it. We have a 188 number. It's 1-800, can't remember the number. It's okay. And the family pushed forward. Warren Hatch at that time was the rep from Utah and said, let's make this a thing. So it took about 5 years of really pushing and kind of pushing it forward. But this is just kind of my plug for always one person can make a difference, right? If you have an idea, it might not happen immediately, but we can make it happen. So a little bit about the numbers. Why I work in the field I do now is I've worked in children's health for years and injury prevention. What's the #1 killer of kids?
Gun violence.
Gun violence right now. And that study came out a couple of years ago from the CDC. And for some reason, that's when the light bulb went off. Everyone was like, oh my, like this is something we need to pay attention to. Like, where were you for all these other studies? But it was that one study from the CDC that people kind of woke up and said, we really need to pay attention to this. But look at the numbers. In 2024, 5,000, that number no doubt goes up every single day. Unfortunately, we have a Slack channel at Brady, and it's called North Star. Whenever there's a shooting, it goes off, and unfortunately it doesn't stop, right? Because it's going every single day. There's some kind of shooting across the country. And like we said last week in Georgia, I want to say that was the 45th school shooting that we've had so far this year, which is unacceptable. So a little bit when we talk, and you mentioned this as well, is when we talk about gun violence, most people think homicide, right? Most people think school shooting, mass shooting, but in fact, it's actually gun suicide. And so our role here is, and we'll get into the specifics, but to really let people know that putting time and space between someone in crisis and their firearm can save their life. And so you can see the other numbers too. It's about 39% for homicides, mass shooting, unintentional. What we work with at Brady is access, right? So I'll get into the campaign, but it's unintentional injury, kids getting into guns, and they shouldn't have it. We lose 8 children a day from kids getting into guns. And Virginia had that big high profile, I think it was last year, where like a 6 or 7-year-old took their gun in their backpack to school and shot their teacher. How can a young kid get access to a gun? We have a lot of people that leave their guns in their car, and they say it's in the car, it's okay. And we just had a case in Indianapolis with 2 5-year-olds who were playing around in the car while mom went into the grocery store or the convenience store, and they were playing around with guns on. It was loaded and locked in the car. And so unfortunately, it wasn't the first case in that region, so we really had to get involved. We talked a little bit about it. If you are suicidal or in crisis, you have access to a gun, that is, you're 300% more likely to actually try to take your own life. The second one, the 76%, is a Secret Service report. 76% of all school shootings, the shooter got the gun from the home, and it was a safety story. If you look how many, and this has gone up, so the 4.6 million is the study from last year. 4.6 million kids who live in a house with an unsecured gun. What we see is, if you look at the latest report, there's it's a publication called The Trace, and I want to say there was 124,000 new guns fired in August alone. And so we're talking like thousands more guns coming into communities because, for a multitude of reasons, not safely stored when kids are getting access. And then you can see, so our goal with parents and gun owners, if you have a gun, keep it safely stored and secured. So right now, so this is an all-time high. No one's talking about firearm suicide. The other aspect, when we started this when I was with my suicide group, is across the board, if you look at the CDC stats when they come out, who kills themselves the most would be older white men, right? And so we took that number and we said, CDC, is that accurate though? Let's dig in. How come no one's talking about Black and brown communities that are suffering suicide and no one's paying attention? Well, the Congressional Black Caucus, working with the Hill, in 2020, did a report called Sound the Alarm, or Ring the Alarm, I think it's called. That was the first time they started looking at young Black men taking their own life. And all of a sudden, just like the CDC report earlier, is that we need to pay attention to this. This is impacting our community. But unfortunately, March 2020, what happened? Pandemic, right? So it got no attention. So we've been really calling attention to the issue is that no one's talking about it. If you look at the sheer number, one number that comes out from the CDC, and we're trying to force them to go deeper, look at communities, look where the spikes are, look at region, look at race, look at ethnicity, demographic, all different areas, and start really approaching this. And just look at that top number. So now you can see the lethality, we talked about it. If you, and there's an article, and I can share this later too, but one of our communications teams shared with the staff, very bravely and very courageously, her own suicide attempt story. And the title is it, I'm alive today because I didn't have access to a gun. And what she shared, she said, I was not the quote-unquote profile of a typical, I belonged to a lot of clubs, I was a happy kid, I was just always around with a lot of friends, but I was suffering internally. And she said, my parents didn't have a gun, and my neighbors all had theirs safely stored, so I overdosed. And then she ended up having to be airlifted, going through months and months of relearning to walk, to eat, to talk. But she shared that story with us, and she said, if I had access to a gun, I would have taken my own life. And what happened, she survived, right? If you look at the statistics, if you have a gun, 90% of the time it's legal. And then if you look at overdoses, it's like 2% and more. And so, not that you're encouraging one over the other, but access to a firearm is legal for obvious reasons. Now, if you don't take your own life and you survive, you're like 89% likely to never try to take your own life again, which is, so again, it's time and space between someone and their gun. The two parts of our campaign, there's two different elements. It's safe storage at the left, and then there's a new campaign coming in. You may have seen, it goes by ERPA, which is Extreme Risk Protection Orders, also called red flag laws. Each state has a different term, like gun violence restraining orders, firearm restraining orders. This is really, each state has a different, there's 22 states, including DC. And if you know someone's in crisis, if you know someone's in danger of harming themselves or others, there's a process to get them involved in removing firearms. So those are our two major campaigns. A little bit about our Interfaith Fire Safe Storage. This is encouraging basically safe storage. So it's, if you have a gun, we do work with gun owners. If you have a gun or you know someone has a gun, keep it safely stored, keep it locked up. We also do not get political on this side. Brady does, for obvious, but on this side we do not. We stay nonpartisan. We partner with the Ad Council. And then we make families is key to this. So we're saying in your home, if you have a gun, with that gun, as you said, that's the danger. It's not from someone coming outside. The gun in your home is probably the most dangerous. We talk about the different levels of gun laws, and now some of you are nursing. We have a campaign called This Is Our Lane, where we work specifically with hospitals to train them. Because what was happening, you may have heard this, there was a doctor, he's from, I want to say like Herndon, somewhere out in Virginia. When he was 17, he was in a high school game, got shot in the neck, and ended up almost losing his life. And for them, he said, I want to be a trauma surgeon when I grow up. And he did, and he's now the head of trauma surgery for Johns Hopkins. And gun violence, for obvious reasons, is his big key issue. And what he says, he got really mad one day. He said, I was on duty on call all night in the hospital. I was super tired, woke up, saw politicians on the TV talking about, like, doctors, stay out of this. This is not your lane. He said, this is our lane. Unfortunately, in the ED, we are seeing patients who are victims of gun violence each and every day, having to tell their parents, having to tell their family members that I couldn't save them. He's like, I am central to this issue. So what I want to do is talk to patients. But then he realized the other residents and other employees didn't know how to have a conversation. I mean, you know the difference between a cable lock and a trigger lock? How to put it on a gun? He's never had a gun. So we're working with him to develop a playbook. We can share it with everybody here too. But it really goes through how to have a conversation with the patient, how to have a conversation with anybody in the hospital about gun violence, safe storage, especially if they're resistant, right? And it gives you scripts, it gives you play, and everything will work out. A little bit about how we do the campaign too. It's not just, you'll see at the end, we don't just throw PSAs and public service announcements out there. We do about a year of research initially, and then we test it throughout focus groups. We do a lot of focus groups, and I get to witness, yeah, I have 11 guns in my home. Oh wait, I can only find 8. Oh, okay, where are the other guns? I don't know, they're probably around here somewhere. Are they loaded? I don't know. And so our goal with that is like to realize the danger between your families. And so we do qualitative interviews, we do quantitative interviews, we launch the campaign, and then we get it out to market. And I won't go into detail, but here, when we question people, how do you have a gun? The number one reason is to protect my family. And that's when we go in and say, you are putting your family in danger if you're not storing a gun safely. How do you define safe? Yeah, my gun's safe. What does that mean? And we did a whole campaign, which I'll get into in a second too. People have different perceptions of what's safe and secure. It's, again, one family tell us, it's on the bookshelf. My kid does not read, it's okay. He only plays video games, he'll never find it. We're like, what? He did. And the older brother actually was the one who said, hey, he was playing with the gun the other day. And so, so then he said, I went out and bought a safe the very next day. We actually had someone write into us this week and said, I saw your PSA on the TV, and I didn't think I had an issue, but something was just eating at me. Something told me I needed to change things a little bit different. So I talked to my husband, went out and bought a safe, and the next day, their child came to them and confessed, I was planning to take my own life. And I went to find the gun, I couldn't find it, there was a box, I didn't know the key. And so, that saved my life, I need help. And so it was just that one video, that one testimony, and stuff like that is what keeps us going. Across the board, all of our different campaigns, it's protection for the family. I need my gun right away in the case of an emergency if someone comes in. Well, there's a lot of really cool apps that we're doing now. There's one that locks your gun in your holster by your bed. And if you're going to go out, you're drinking, or you're out, and you're going to be inebriated, it can lock it for a certain amount of time. If you're in crisis, it locks it for even longer. And a second party has to open that. So there's a lot of new technology that we're working on with a lot of companies to say it's not just an old safe, not just a cable lock. There's a lot of cool ways too out there. Protection, we saw that, it's American, and you see the flag and the gun, and it's all, we're working with them to kind of change that narrative with Brady across the board. And one of our campaigns is working with Hollywood, right? Because if you start depicting, shoot 'em up movies of John Wick or something like that, how do you reverse engineer that and say when he comes home, putting his gun away first, showing safe storage is really working. So we had over 200 screenwriters sign on. We were working a lot with Paramount and other studios to get actors, screenwriters, producers all engaged on the messaging. And again, these are a little bit about what our campaigns, and you can find these on our website or more. The first one launched, Justin, it's unintentional. When a kid finds a gun in the home, talks to your dad about it. Second one, 2020, we talked about suicide. Then we launched, we said veterans are leading. If you look at the number of veteran suicides, we used to talk about them. So we took a number of veterans, all different branches, and all different combat, non-combat, and had them tell their stories. 2023 we had so many shootings, mass shootings that year. Stations reached out to us and said, will you produce a public service announcement that shows all of this? We need something evergreen, because unfortunately, a lot of these issues cross. We want something that shows all of this gun violence. So in that video there, it's probably one of our most hard-hitting ones. And one of the issues is it shows a dad, and he keeps his gun in the nightstand. And then it shows his daughter accidentally finds the gun, and she accidentally shoots the mom. It shows his son getting in there, and he's calling 911 because his son had taken his own life. And then it shows the third one, breaking news, school shooting. He opens up the door, and it does anything. And so that's what we're finding impacts most. When the audience see that, they're like, oh, that could happen. That could happen in my life. And then we worked with athletes, including, I want to say, Josh Morgan here from DC. And what they realized is when we have guns, we have gun owners, we're getting shot, we're getting attacked by guns. We really need to work with other communities to talk about who the safest word. And so just like unboxing, that was the YouTube channel a while back for kids and electronics, one of the things they're working with is gun boxing. We've done in the box, we need to be clear. Then we talked about firearm suicide. This was Safe Stories. People sharing their stories about one mom in there, her name is Reba. She was a corrections officer for many, many years in Missouri. And then she lost her son to suicide. And she said, that's it, my life's over. I have no reason to live anymore. And she found out the day of her son's funeral that she was going to be a grandmother. That the son's fiance was pregnant. And she said, now I have a reason to live. And the stories that they tell in there is like, she was another crisis, I'm putting down. I need to keep my gun, save this story, and wait for me. Then what we did, we realized that it's in Spanish. There's no international campaign in Spanish around the country. And so what we did, we took two dads in Miami, and we had them gun owners, so we had them, oh, I have guns, I have multiple guns, I love guns, and here's why. And then we had them, they were being interviewed. And then we had a mom, we had two moms write letters about losing their children to gunfire. And the dads, were interviewing and then read this letter. They started reading the letter, and as they were broke down to tears. The one dad, Augustine, he said, Chris was killed by a revolver. I own a revolver. This could have been my gun that kills Chris. And he started to cry. And so you can see those videos as well. And then the one we just launched was new gun owners. We realized all of these guns and regulations keep talking. You know, there's been a lot of attacks, right, on different communities lately. Some of them for self-safety were purchased. Some of them were just these regulations because of the loopholes with gun purchasing, things like that. So we took that and we're really calling out communities. It's not just like what you would typically think of as a gun owner. The changing face of a gun owner is kind of surprising everyone to pull that out. So just a couple more on that. You can see. This is just access, unintentional, the suicide. And then we measure everything, all our campaigns were measured from the minute they launch to monthly, to then wrap up. And you can see, if you've seen these, and working with Ad Council, I don't know how many people here have ever heard of Ad Council. They work on like Smoothie Bear, something like national campaigns, vaccines. One of the things that they did with the campaign is when they pushed out, they said, you know, if you've seen this video, you are, you know, ad aware versus not aware, you can see the increases go up. And so you're more likely to, you know, there's a gun, danger, a gun at home. You're more likely to ask a friend or a family member about a gun. You're more likely to change where you're actually storing your gun. And so we don't pay a lot of the placement. Thanks to the Ad Council, we get a massive, we get during the World Cup, so during the NFL Sunday games, we get placements and PSAs there. So they're seen. We actually had a DEA, they had a form of the DEA, one of the old ones lived in West Virginia. We called them and said, I was driving and I saw your billboard. I want to learn more about what you did. And so we have billboards, we have benches, we have placements all around the city, buses, and things like that. A little bit about extreme risk protection orders. Like I said, each community is completely different, and each state has a different term, a different name, a different process, and a different petition. But a little bit about, we go to 21 states in DC, this is where they are. And we did an study to realize, people said, oh, I know, if someone in my house is a danger, I know what to do. Do you? What would you do? And then they didn't, right? And so we had to go and kind of teach them. So again, if you know someone in crisis, when time and space between them and their gun is going to save their life. We realized we need to be localized. So we did a partnership with the Illinois Department of Public Health. We said, let's do an Illinois state launch first. We had a funder, and what we did is Ad Council brought the ability to get donated media. Brady was a subject matter expert. IDPH was Illinois state specific. And then what we were able to do is launch the Pause and Heal campaign. And you can see we didn't have a separate website. We put it on the .gov website for trust, right? They wanted to see it. And then you have resources, there's a PSA, there's a radio spot, there's billboards all around the state. And now what's happening, other states are reaching out, like New York reached out to us, Minnesota reached out to us, and they said they want to actually take it. Then yesterday we had a hospital system up in, it was Danbury, Connecticut. Right, so we were talking to them about, it was the radio cameras. And so we were talking about the team that had to deal with all the kids that were there in Newtown. And talking about, do you transport the kids? You can't transport the kids because they're not going to make it. And talking about what it was like in that hospital system in Newtown. And so what they want to do now is kind of take this campaign to start educating others in the community about pause and heal. Like, we're not just going to take your guns indefinitely. You're in crisis. We're just going to keep your family safe. So you can see some of the ads that we run in Illinois. And then that's my email if you have any questions. But that's everything about Virgos and Empire. And one of the things about, so Brady is known. So we come in sometimes next to that star of Brady is shuts the conversation down. And they're like, we don't want this. Like, you're going to take our guns. And Family Fire, being nonpartisan, Fox News actually reached out to us. And we went up on Fox and Friends, and they actually were talking about safety.
So before you all get into the Q&A, how many in here know who James Brady was?
Wow, that's more than usual. That's awesome.
So, would you like to share who James Brady was and why the Brady Company created?
So Jim Brady was press secretary for Ronald Reagan at the time. And remember when the assassination attempt on Reagan, Brady was shot. And he ended up in a wheelchair for the rest of his life. He ended up dying, he ended up dying from complications from the initial gunshot. So he and his wife Sarah began something, as once that is called Handgun Control Inc. They started the foundation and said this is unnecessary. She even said she was a governor at one point, and she said, we've had some scary things happen, like this needs to stop. And then that was back in the 80s. And here we are, 20 years later, still fighting the cause. But that's why everything is founded quickly and free.
There was one example of a mentally ill person who did commit gun violence. John Hinckley spent 25, 30 years in St. Elizabeth's. But again, that's rare. It's rare that a person with mental illness will cause that kind of gun violence. I have a question for the audience. I see a lot of young women here. Let's say you're living alone in an apartment in a neighborhood that's kind of dicey. What can you do short of having a gun in the apartment that could protect you? What? Thank you. Pepper spray. Have pepper spray. As an old man who doesn't run very fast anymore, when I'm walking back from the metro at night, I always keep this on my keychain, and I keep it out. And if somebody approaches me that looks threatening, right in their eyes is an LED light. It's very bright, particularly if you get, and if that doesn't work, I do that. That draws attention.
The other element too, speaking of violence against women, today is the 30th anniversary of the Violence Against Women Act. And if you look, I'm sure you look, coming out of the White House today, the White House has spent a lot of time and effort. They are doubling down on making life safer for women to do. So there's a lot more money going to the states for community violence initiatives. There's a lot more funding being released to stop that loophole, boyfriend loophole. So speaking of violence against women, take a minute today to kind of Google that and see the White House is up to.
All right, thank you guys so much. So I just have a total of 5 questions altogether. So looking at policy and legislation, what role do background checks play in preventing gun violence, and are there any gaps or areas for improvement in the current system?
Would you repeat the question? I was looking at this.
Under number 2. What role do background checks play in preventing gun violence, and are there any gaps or areas for improvement in the current system?
There are a lot of gaps in the system, for one thing. Doing the background check, it depends on where you are and what records are being kept. If the police departments aren't keeping good records, or the state's not keeping good records, you're going to miss a lot of people who are a threat to the community. We just had, oh yes, a perfect example. The man who threw his gun into the storm drain the other 2 weeks ago or a week ago, and then the police officers tried to retrieve it, and then it accidentally went off and killed him. That man had a number of charges against him. The result was he wasn't even supposed to have a handgun. So the background checks, there's lots of holes and loops in the background checks. And a lot of people fall through and they're not flagged.
Yeah, and the other thing too is like the boyfriend loophole that I mentioned too, unless, it depends on how domestic partnership is defined in some of the states. If you're living with that person, if you're not living with that person, a lot of the times it's like, can you acquire a gun? You may not have committed something in the past, but now someone's worried about you. So there's a lot of like, there's a boyfriend, there's a straw purchase one, where someone's buying on behalf of a friend. And so that, in waiting periods and things like that. The other element too, that sometimes doesn't get factored in here, are the gun shops selling the guns. So there's a master list you can look up, and Brady has something called the Gun Store Transparency Project. And 90% of the crimes and the kind of the after gun, when the guns are used in crimes, comes from 5% of the dealers. So 5% of all the gun shops across the country are the bad actors. There's not enough funding for whether it's the ATF or the local law enforcement to check them. So that element too has to be factored in.
So looking at the societal and cultural factors, how do societal attitudes towards guns and gun ownership impact gun violence prevention efforts? And so with this question, I think more of media, music videos, video games, Grand Theft Auto, that type of stuff.
I would like to say that one of the big problems in this country is that we have a Wild West mentality, and particularly for men. It's macho for a man to have a gun. He's a cowboy. And we've been, ever since movies were invented, that's what's promoted on television and in the movies. Cowboys with their pistols and their rifles and so forth. So this goes back decades and decades and decades. That's a societal attitude in this country, that it's manly and macho to have a gun.
And I think that's why we're working with Hollywood, right? So Brady's campaign is called Show Gun Safety, and it's really kind of changing that narrative. Like, look at seatbelts. If you look back in the 70s, there were no seatbelts. And what happened, the insurance agencies came in and said, you cannot use my car, or we're not going to insure the film if you don't have seatbelts in the car crashes. And so the same with smoking, right? Like what happened with smoking was kind of changing that where it's cool. And so that we're at the very beginning stages, but that's one of our efforts.
Okay, I'll go with one more and then I'll do Q&A. So looking at that public health approach, because we are the DC Public Health Association, and all about public health, how does viewing gun violence as a public health issue? You know that Dr. Benjamin, who is the president of the American Public Health Association, he declared it a national emergency. So how does viewing gun violence as a public health issue change the strategies used to prevent it?
One of the things that those of us in gun violence prevention started doing, we stopped talking about gun control and gun control laws, because that just sets the people that want guns say, you have no right to control guns. We have a Second Amendment that prevents you from doing that. And so we're talking about this as a public health problem. People are dying, people are being injured on a regular basis. Post-traumatic stress is being caused in the family, the friends, the co-workers of people who are the victims of gun violence. And as we both shared, the numbers are incredible in this country. Absolutely incredible. Between 40 and 49,000 people a year are dying from guns. I mean, I don't know what the cancer statistics are, but there's probably fewer people with prostate cancer than that. I don't know.
Well, I think it's twofold. I think number one, it opens up more funding once you do that, right? Because more agencies get involved and say, we have to have a handle on this. It also lets people know it's not just one sector. This is every field that it's impacting now, whether it's mental health, physical health, social work, all these other groups. But then the challenge that I have, and we do fight the term gun control because the media shuts down, and if you say that's used against our, so we prefer gun violence. One of the questions that we have is, outside this field, how many people understand what the term public health means? And so that's what we've been struggling with. And Brady did once, we came to him, we're approaching this and saying, this is a public health issue, trying to do that sphere of like, here's all the entities involved. But we're finding that a lot of people don't understand what public health means. And so we're having to do education on the front end as well.
Which is what we did with the campaign against cigarette smoking, right? We said it's causing heart disease, it's causing lung cancer, chronic obstructive pulmonary disease. It became a public health problem. Guess what? When I was growing up, you could walk into any place, a restaurant, a movie theater, anywhere, and the air was thick with cigarette smoke. You don't see that anymore. We got rid of people being able to smoke in public places. We can do the same thing with gun violence.
And I remember the non-smoking section and the smoking section at restaurants, which really made no sense at all. Okay, so any questions before we start to conclude this? Any questions for yes? Okay.
Wait for the microphone, please.
I did say that we are, more gun violence. But I think there is, a lot of teens and children are purchasing ghost guns. So they're buying pieces of guns off the internet and then putting them together, which, causes more harm because you don't know if it's safe or not. So how do we, I guess, prevent or find a way to interfere with those type of purchases so therefore you're not, put out in the public?
All right, ghost guns are a real problem because they're unregistered. You put them together, there's no registration number on them. Law enforcement hates ghost guns because they can't track them and they can't track who's using them. When we do the gun buybacks, if you hand in a ghost gun or an assault weapon, we were giving you $200 per weapon in giant gift cards, giant food gift cards. If you hand in a pistol or a hunting rifle, you only get a $100 gift card. Because those two things, the assault weapons and the ghost guns, are the most lethal and cause an awful lot of problem, not just for the people that are victimized, but for law enforcement.
Just check, does everyone know what a ghost gun is? Right, so if you go on the Team and website, there's one of the students, Stefan, he actually goes through the process of how you can purchase. I'm under 18, I bought all the pieces, I can assemble the gun, it's not registered. They raised that, they were first ones in Baltimore. Baltimore's a big city for us. And they worked and became kind of an all hands on deck approach. And they went to the law enforcement, they went to the mayor's office, they went to the governor's office, and they just said, we need to address this. And so they kind of destigmatized the ghost guns a little bit. But what they were finding is people didn't understand it. And so they worked with the online retailers, right? Being able to check in with online retailers and say, are you selling? And you be sure this person is over 18? And then they started lawsuits because Brady has a whole legal team, right? They started going after the manufacturers of these ghost guns. And they're able to say, your gun was found, this person acquired it, and it killed this many people. Here's what's happening. And so they were able to trace back to some of the gun manufacturers. So the numbers in Baltimore have just started going down, but we realized this takes an awareness approach, and then it takes all parties to get involved, and then start working and going after the sellers. Because the other thing that we're starting to find too is 3D printing, because not just ghost guns, you can now print guns, and making kind of sure that people know about that, and then making sure people are prepared for that.
I think one of the strategies here is to work with law enforcement, because at least the police that I've spoken to, they don't want assault weapons in public hands of citizens, because it puts law enforcement officers at much greater risk. These are assault weapons. The same is true of ghost guns that can't be tracked. They don't want that. So if we can work with law enforcement to put pressure on the politicians to pass legislation to outlaw assault weapons and ghost guns, that's one strategy we should be considering.
Professor Monet? My question is, and this is, it's more of a statement I know, this is something that's been bothering me for years. I live in Ward 8, one of the poorest wards in the district. Why do we have the most guns? And what is the purpose and what is the benefit for gun buyback? With my eyes, in my mind, I see, I'm telling you, if you want to for guns, I'm getting better guns. And that's the mindset of the company now. And now I didn't have to go raw, and I didn't have to hurt anyone to get that money. You're going to give it back to me when I give you this raggedy gun that costs like several bodies of me. I don't need that anymore. I'm going to trade this in, you're going to give me $150. I'm going to go back to getting the gun. What are we doing in Ward 8 that I don't know, and that's why I'm asking. What are we doing to aim at guns coming in? Someone is bringing those guns in. It's not us, we can't afford it. So who is bringing the guns in? Who is allowing the guns to come in for our youth to be able to explore their neighborhoods and stuff like that?
A lot of the proliferation of guns, particularly in places like Ward 8, the guns are coming in mostly from Virginia and other states that have very loose gun laws. There's also an interface between guns and gang violence. There's a lot of drug dealers and so forth, and of course that's part of their, keeping their practice going, making sure that they have guns to intimidate people and so forth. The gun buyback is useful for this. If there's no gun in the house, you can decrease the likelihood of suicide, for one thing, or domestic violence. With the gun buyback, we don't give money. We give giant gift cards. They can only be used to purchase food at giant food stores. Well, yeah, of course. I remember years ago when we were doing HIV and AIDS prevention work out on the streets, we were giving out condoms to people. What were they doing? They were turning around and selling them, okay, and converting them into money. So we started limiting the number of condoms we used to give people so, they couldn't make a lot of money off them. So that's one of the things we have to do. We have to be really careful. I think a large thing is to work with the churches in Ward 8 to get people to understand if they know something, who's got guns, why are they using them and so forth, and alert law enforcement to it, to decrease the amount of violence going on in the community. But people have to speak up.
And I also think crack down the sellers, because go after those gun stores that are not checking IDs. We had one case, I forget where it was, but they literally showed the surveillance, and they had a wheelbarrow full of guns that they were getting out the back door from the shop, and it was one person, because they paid off one of the employees, and they had taken a bunch of guns. There's no check, and they can get it in circulation. There are some issues with gun buybacks, just to be careful on the back end. If you saw what happened in Detroit, what was happening is they said, we're going to take all the guns and melt them down. And they were taking pieces and then reselling the rest of the guns. And so that's where you're starting to see that question on making sure what happens with that equipment, or whatever you want to call it, the metal. Is it fully being melted down and reused? Is it being melted down, or is it being pieces pulled off and sold? So that's the only thing we want to talk about.
We've made sure when we work with Montgomery County Police and the Sheriff's Office, they were the ones that handled the guns. They put them in pre-made wooden boxes and then brought them directly to an incinerator. Nobody, the boxes with the guns in it were sealed, with screws on the top and everything. So there was little chance that they could take the guns apart or resell them or anything like that. So you have to be really careful when you're doing the gun buyback to make sure that the guns are going where they're supposed to, which is to an incinerator.
What are the efforts in the schools with both the students and the primary and secondary levels? And maybe more broadly with parents and the parent-teacher associations? What kind of educational awareness efforts are ongoing at those levels that could make a difference?
Yeah, no, I think so, kind of top down, bottom up. So if you know, this is the first administration where we've had an Office of Gun Violence Prevention, right? If you look at the leaders, Steph is on there, but there's a DC native, Greg Jackson, who's here, and he's been working really hard to give the community, they've been breaking it down by sector, and like what you, hospitals, students, schools, and what they did is probably about 3 months ago, they brought together the Secretary of Education, they brought together the ATF, and they brought together principals and superintendents and members of schools that have been impacted by school violence. And they brought them into a forum and said, you guys are the experts, what do we need to do at the national level and policy to address this? And what they came out with, and the Secretary Cardona came up and said, unfortunately, the school systems don't get involved until after a mass shooting, right? And then it's the, what do we need to do, what kind of protocols, what do we miss? We need to engineer the system so that we get ahead of this. Superintendents do have a role to play in stopping gun violence within our communities and our schools. And so what they, that kind of became the, okay, now all the superintendents around the country, they have like their check box, here's the Secretary of Education said we can do this. And individually they've started plans on how to address it. What that means is like the New York Department of Education, Berkeley out in California, a lot of other schools, what they've done is they've sent letters to the parents talking about safe storage, talking about here's the rules in our school if you see anything. Here's the rules on if your child is caught carrying a gun and what it looks like for school. And here's our tolerance. So they've been sending that from the Secretary for the country, the State Departments of Education, and then groups like the school superintendents, the principals associations, and it's been drilling down by community to community. And it's sending things home with parents, but then also telling them like, we're changing our policies, here's what it means for you.
Is there a role for the parents and caregivers to play? If that's not coming from the top down, can they put pressure on their local school officials to bring pressure to provide help?
We actually do on our site, on our Brady site. If you go to the Brady page, EFF, there's a how you can help. There's actually a template letter you can send to your school district on, we need to address this, here's where I want that. And so we put those resources out there. We're working with other groups to say, start that mass movement in your community, right? If you make loud enough noise, you can get them to listen. And if not, then they reach out to us and we go, here's what the community in Minnesota did, here's what the community in California did, here's what the community did in Michigan. And so we're able to kind of back them up whenever possible.
Is there a way to track those efforts to see if they're effective or some approach is better than the other? The profession of the school officials to do our job?
We've been working, so the letters when they come out from the State Department of Ed, we've been working with them on tracking how many, what does that look like, and then mapping it to incident rates, then it gets into correlation versus causation and all of that. We've been working with them to try to figure out how to track that.
Let me just add this. Gun violence is causing school districts throughout the country to spend enormous amounts of money in setting up metal detectors in the schools, having hiring officers to be present, who have guns to be present. This past week, Petra Dvorak in the Washington Post wrote an article about this very issue. It's the taxpayers that are paying for all these expenses. to prevent gun violence in the schools, with the metal detectors, with officers in the schools and so forth. She recommends that we put pressure on the gun manufacturers to pay for that. Not the taxpayer, the gun manufacturers. So that's one of the things we can start looking at as a way to stop this insanity in schools.
It worked with smoking.
Yep.
And that's how they were on their campaign.
Okay. So my question is, how can we trust law enforcement? How can we trust law enforcement and the police department with gun violence when, especially the black and brown people, are targeted by police officers? Also, when you mentioned police officers in the school, there are they don't just like schools with the pipeline, with police officers in the school, that target driving around the school. So how can we trust the police to take care of this?
I wish I had a simple answer to that one. I don't. Yeah. I think one of the things that all police departments have to do is a better screening job and better training of police officers. They have to weed out the people that are involved in both explicit and implicit bias against black people or people of color in general. And there has to be training on how to de-escalate a situation without using a gun. I mean, so much of it has been unnecessary because it literally overkill that the police are doing. And a lot of innocent, unarmed black men in particular, and some black women, are being killed unnecessarily. It's crazy.
But I think raising that point more often is the first policy issue. They're always like, oh, more law enforcement, or especially with safe storage. If it's off-site storage, they go, just go to your local police department. They're like, that's not safe for every community. Can you give me an alternative? And so I think more people, as we're trying to talk about it, it's getting on more individuals' radars that, oh, we do have to do that. So for me, it's just not having to say that all the time and being able to say, well, people understand that law enforcement is not the safest option for every community.
And get involved, your young people, get involved with March for Our Lives, the organization was started by David Cobb, who was the young man that survived the mass shooting in Marjorie Stoneman Douglas High School. That organization is working very diligently and raising a lot of money to put pressure on politicians and to elect politicians that will be supporting gun violence prevention and putting pressure on police to stop killing unarmed people.
Hello, everyone. Good evening, and I do appreciate this forum on gun violence because it has now become a massive concern not only for just young people but for the entire nation. And my question is, I've heard a lot of mentions about getting adults before authority to get them to do whatever is necessary to help reduce and prevent gun violence. How about implementing measures to the children themselves, the teenagers, the middle-aged teenagers, and the adolescents themselves, those are the actual perpetrators or doing the actual gun violence? What are the implementations put in place to address these people, bring them to order, educate them, go to school, just like how the police go and tell them about fire drill, emergency? They can do the same. Volunteers can go out to the school because they have organizations that is designed to do these things. But just targeting the police and the authority and the parents, I don't think that alone is going to help. Because the parents are not the ones who are just going out, the teenagers are doing that too. So they need to be addressed.
Yeah, no, and I think this is where, and Chicago is doing this a lot more. They're testing that and really going to, there's another group too, but in Chicago they were saying, you're the impacted community right here. You your age, your demographic, your numbers look like, what's the solution? And you'll see the White House just actually brought everyone together. They're doing it again, I think, next month, is bringing it, and Aalayah, if you see all, like, Aalayah does not stop. She's speaking all the time. She goes out and she says, you know, this impacted my school. No one's, like, thank you adults for telling us what we need. We're living this on a daily basis. This is what we need. And so a lot through March for Our Lives, through Teaming Up, through Students Demand Action, a lot of other groups. Chicago Public Schools recognize it. They're doing projects. We definitely need to get the youth voice out more often.
One of the things that we can do in schools, and at one time in my life, I was a high school teacher. We have to do a better job at helping students manage their emotions, and particularly their anger. We can do that in the schools. That should be part of their education, how to manage and regulate their feelings, all right? So that it doesn't lead to violence. The other thing, and I think this is a hopeful sign, anytime a young person, like the young man, the 14-year-old that just shot up the people in Georgia, anytime that person gets a weapon to do that from their home, the parent should be prosecuted, put them in jail. That's going to change a lot. If parents realize they have to have the authority to not let their kids have access to guns.
Any other questions? Good. Okay, so as we conclude, we want to have a call to action, right? So what can you do even here? Not just extra credit, right? But what can you do to educate someone else? You guys are in clinical positions, will be in clinical positions in the community. So being educated, staying informed, getting involved. It's very important for students to get involved even after you graduate. Good letters of recommendation, right? It's good talking points when you are in interviews, especially with that community awareness. Engaging in advocacy. So I definitely know that the OTs go to the Hill. On APHA's website, they actually have policies that you can just literally click and it will go to your representative about certain issues. We can share that later. Promoting awareness. So there are some orange ribbons in the back. Again, getting involved, liking them on Instagram, resharing things. You never know when, if you reshare something, how impactful that can be for someone else. This young generation is, definitely into social media more than us older people. So it's important for you to share things, even if it doesn't impact you, it could impact somebody else. Foster some dialogue. So when you go home, talk to anyone who is younger than you. What do you know about guns? If I wanted a gun right now, where can I get a gun? Right? We do that with other things, other substances, but what about the guns? And then support the survivors and affected communities. So my issue is that when things like, Atlanta happens, or Parkland, or just name any kind of city, they're there for 5 minutes and then they're gone to go about our day, right? 9/11 was yesterday. Did you think about it today? Right. Some people did, some people did not. And we have to make it something that we think about every single day, because more than likely, the nurses in here are gonna find someone in your hospital that you are treating that has a gun wound, right? Previously or currently. And like Colleen was talking about, that gun wound, not right away can help or hurt somebody, but long term. It'd be, you guys can help with that later. But just think about the health impacts and the mental impacts of that. So again, thank you so much for coming out. We appreciate you. Yes.
So you said a call to action. What is the suicide prevention line? Everybody gets it, right? So that's one of those major call to action things. We all now know that we heard it. hear it all the time.
And you can text it.
Exactly, and not just knowing it, but sharing.
Or even just checking in on a friend. That's my big one too. If you haven't talked to a friend or a colleague, you know, it's been kind of quiet or whatever, just check in, send a text. How are you? Haven't heard from you. Thinking about you. We hear a lot of times that one text is like, okay, now I know someone's caring about me.
Oh, yeah, for veterans as well. Okay, so if you know a veteran or you are a veteran, 988, press number 1. Very important. Thank you guys so much. I appreciate it.